Your tongue was cemented to the roof of your mouth at 3 a.m. You woke up choking on nothing. Mouth so dry it felt like you swallowed sand. Grabbed the glass on your nightstand. Drained it. Fell back asleep. Woke up at 6. Same thing. Bone dry. Again. Tomorrow morning. Same. Next week. Same. You've accepted it. Normalized it. Told yourself it's just how sleep works now. It's not. And every morning you ignore it, you're one day closer to a diagnosis that will change your life. 69-year-old man. My ER. Chest pain. Standard workup. I asked him one question 4 doctors in 2 years never bothered to ask. Do you wake up with dry mouth? He stared at me. Every single morning, doc. For 2 years. Told my GP. Told my cardiologist. Told my urologist. All 3 said drink more water. All 3 were wrong. I ordered tests, none of them ran. Salivary flow 40% below normal. Fasting glucose pre-diabetic. Autonomic nervous system in early failure. Overnight oxygen crashing to 81%. Kidneys silently deteriorating for 18 months. 0 symptoms. 0 flags. 0 abnormal panels. Except that dry mouth he reported to every doctor who told him to buy a humidifier and stop worrying. That man was 6 months from kidney failure. 8 months from a diabetic crisis. Already an early autonomic collapse. And the only alarm his body had left was the one every doctor in his life threw in the trash. Dry mouth is not a nuisance. It's a distress signal. Fired before pain, before fatigue, before a single lab moves. Your body sends this first, and you've been drowning it in water and going back to sleep. In this video, we will reveal the 6 conditions hide behind dry mouth, ranked from least to most urgent. And stick with me because number 3 is a condition so quiet that dry mouth is the only warning your body sends before permanent damage sets in. Every reference is in the description. Also drop what country you're watching from in the comments below. I read and personally reply to every single comment. Now let's start with warning number 6. This one hides behind dry mouth for years, and when it finally shows up in your blood work, it's already too late to reverse. Number 6. Your medications are drying you out from the inside. This is the warning that hides in plain sight, and almost nobody connects the dots. If you take any kind of medication regularly, whether it is for blood pressure, allergies, anxiety, depression, or even simple over-the-counter pain relief, there is a very real chance that your pills are the reason you wake up with a mouth that feels like cotton. A study published in the journal Oral Diseases analyzed over 500 commonly prescribed medications and found that more than 400 of them list dry mouth as a side effect. That is over 80% of the most widely used drugs on the market. The medical term for this is xerostomia, which simply means your salivary glands are not producing enough saliva. And medications cause this by interfering with the nerve signals that tell your glands to produce moisture. Antihistamines are some of the worst offenders. A 2019 study in the Journal of Allergy and Clinical Immunology found that people who took antihistamines daily experienced a 35% reduction in saliva production within just 2 weeks. Blood pressure medications called diuretics are designed to flush fluid out of your body, and they do not discriminate. They pull moisture from everywhere, including your mouth. Antidepressants, specifically SSRIs, blocks certain receptors that also happen to control saliva flow. Researchers at the University of Toronto found that patients on SSRIs had 42% less saliva volume during sleep compared to those not on these medications. The problem compounds when you take multiple medications at once, which is incredibly common for people over 50. A study in the Journal of the American Geriatric Society found that adults taking 3 or more medications simultaneously were 2.8 times more likely to suffer from severe dry mouth than those on a single medication. So what do you do about this? First, never stop taking prescribed medication without talking to your doctor, but have an honest conversation about alternatives. Many drug classes have newer versions with fewer side effects. Second, if switching is not an option, timing matters. Taking certain medications earlier in the day instead of at bedtime can reduce how much they dry out your mouth overnight. Third, keep water on your nightstand and take small sips if you wake up during the night. Some people find that a bedroom humidifier running at 40 to 50% humidity makes a significant difference. You can also try alcohol-free mouth rinses designed specifically for dry mouth before bed. These contain ingredients like xylitol that stimulate residual saliva production. A clinical trial at the University of Pennsylvania showed that patients using xylitol rinses before sleep reported a 28% improvement in morning mouth moisture after just 3 weeks. The key is understanding that your medication may be essential for one part of your health while quietly undermining another, and that awareness alone puts you ahead of most people. But medications are only one piece of this puzzle, because the next warning goes much deeper than any pill bottle. Number 5. Dehydration is doing more damage than you think. Most people hear the word dehydration and think it just means you did not drink enough water during the day. But the science tells a completely different and much more alarming story. When you wake up with a dry mouth, your body may be telling you that your overall hydration status has dropped to a level where your organs are starting to compete for the limited water supply you have. Your body is smart. When water is scarce, it prioritizes your brain, your heart, and your kidneys. Your salivary glands are low on that priority list, so they get cut off first. A 2020 study published in the journal Nutrients found that even mild dehydration, a loss of just 1.5% of your body water, was enough to reduce saliva production by up to 30% during sleep. Most people lose between 1 to 1.5 liters of water overnight just through breathing and sweating, even in a cool room. If you went to bed without being properly hydrated, your body is running on empty by 3 in the morning. A large-scale study by the National Institutes of Health that followed over 11,000 adults for 25 years found something shocking. Adults who were chronically underhydrated had a 20% higher chance of developing age-related diseases and had biological markers that made them appear 2 to 6 years older than their actual age. That means not drinking enough water is literally speeding up how fast you age at a cellular level. Chronic dehydration also thickens your blood, which makes your heart work harder to pump it. Researchers at Loma Linda University found that men who drank 5 or more glasses of water per day had a 54% lower risk of fatal heart disease compared to men who drank 2 or fewer glasses. For women, that reduction was 41%. These are not small numbers. The connection to morning dry mouth is direct. If you consistently wake up parched, your body has been rationing water all night long. So here is what actually works. Stop relying on thirst as your guide, because by the time you feel thirsty, you are already dehydrated. A research team at the University of Connecticut found that thirst signals become less reliable as you age, meaning older adults can be significantly dehydrated and feel no urge to drink at all. Aim for half your body weight in ounces of water throughout the day. If you weigh 160 pounds, that is 80 ounces. Front-load your hydration earlier in the day so you are not chugging water right before bed, which will just wake you up to use the bathroom. Adding a pinch of sea salt or an electrolyte tablet to your evening water helps your body actually retain the fluid instead of just flushing it through. A 2022 study in the European Journal of Nutrition found that water consumed with electrolytes was retained 40% more effectively than plain water. Keep a glass by your bed and take small sips when you notice dryness during the night. This is not about drowning yourself in water. It is about consistent, smart hydration that your body can actually use. Now, what comes next is something most people never even consider, and it has nothing to do with what you drink. Before we roll on, hit like and make sure you're subscribed. The next part might surprise you. Number 4. Your oral microbiome is under attack. Inside your mouth right now, there are over 700 species of bacteria. Before you get alarmed, most of them are good. They protect your gums, help break down food, and keep harmful invaders in check. This community of microorganisms is called your oral microbiome, and saliva is its lifeline. When your mouth dries out at night, you are essentially cutting off the water supply to an entire ecosystem. A landmark study published in the journal Microbiome in 2021 found that people with chronic dry mouth had a 60% higher concentration of harmful bacteria in their mouths compared to people with normal saliva flow. The good bacteria need a moist environment to thrive, and when that moisture disappears overnight, the bad bacteria take over. This is not just about bad breath, although that is certainly one of the symptoms. The harmful bacteria that flourish in a dry mouth produce acids that eat away at your tooth enamel. A study from the University of North Carolina School of Dentistry found that patients with chronic dry mouth developed cavities at 3 times the rate of those with normal saliva production, even when their brushing and flossing habits were identical. That means oral hygiene alone cannot protect you if your mouth is dry all night. It goes even further than cavities. The bacteria that thrive in dry conditions include species linked to gum disease, which is now being connected to conditions far beyond your mouth. Research published in Science Advances in 2020 found a specific bacterium called Porphyromonas gingivalis, which thrives in dry mouths, present in the brain tissue of Alzheimer patients. Scientists discovered that this bacterium can travel from your gums into your bloodstream and cross the blood-brain barrier. A dry mouth at night creates the perfect breeding ground for exactly this type of pathogen. Protecting your oral microbiome is not complicated, but it requires the right approach. First, use a toothpaste and mouthwash that are alcohol-free, because alcohol is one of the biggest destroyers of beneficial oral bacteria. Second, consider using a probiotic specifically designed for oral health. A 2020 clinical trial published in the Journal of Clinical Periodontology showed that participants who took oral probiotics for 12 weeks saw a 44% reduction in harmful bacteria and a significant improvement in gum health. Third, if you breathe through your mouth at night, which we will talk about shortly, your microbiome is being devastated every single night. A mouth tape or a chin strap designed for sleep can keep your mouth closed and preserve that crucial moist environment. Eating fermented foods like yogurt and kimchi also supports oral bacterial diversity. The bottom line is that dry mouth is not just uncomfortable. It is a signal that the first line of defense in your entire immune system is being compromised while you sleep. And speaking of what happens while you sleep, the next warning reveals a hidden danger that starts in your mouth and travels straight to your heart. Number 3. Silent inflammation is building up inside you. When your mouth stays dry for hours during the night, it does not just affect your teeth and gums on the surface. It triggers a chain reaction of inflammation that spreads throughout your entire body. Scientists call this systemic inflammation, and it is now considered one of the root causes of nearly every major chronic disease. Here is how the connection works. When saliva dries up, the tissues in your mouth become irritated and vulnerable. Bacteria that would normally be washed away by saliva now cling to your gums and begin to penetrate below the gum line. Your immune system responds by sending inflammatory molecules to fight the infection. The problem is that this battle happens every single night, and those inflammatory molecules do not stay in your mouth. They enter your bloodstream. A 2019 study published in the Journal of Dental Research measured levels of C-reactive protein, which is the most widely used marker for inflammation in the body, in people with chronic dry mouth. The results were striking. Participants with dry mouth had CRP levels that were 45% higher than the control group. Elevated CRP is directly linked to increased risk of heart attack, stroke, and diabetes. A massive study from Harvard Medical School that followed over 27,000 women for 12 years found that those with the highest levels of chronic inflammation were 3 times more likely to develop cardiovascular disease. The researchers specifically noted that oral health was one of the under-recognized drivers of this inflammation. The connection to diabetes is equally alarming. A 2022 study in diabetes care found that chronic oral inflammation impaired insulin sensitivity by 23%, meaning your cells become worse at using insulin to process sugar. This pushes you toward prediabetes and eventually type 2 diabetes, all because of a process that started with a dry mouth. Reducing this inflammation requires attacking the problem from multiple angles. First, address the dry mouth itself using the strategies already mentioned, including hydration, humidifiers, and alcohol-free rinses. Second, add anti-inflammatory foods to your diet. Omega-3 fatty acids found in fatty fish like salmon and sardines have been shown to reduce CRP levels by up to 30%, according to a meta-analysis published in the American Journal of Clinical Nutrition. Turmeric containing curcumin reduced inflammatory markers by 25% in a clinical trial at the University of California, Los Angeles. Third, get your CRP levels tested at your next blood work appointment. This is a simple and inexpensive test that most doctors do not order unless you specifically ask. Knowing your baseline gives you a number to track and improve. Fourth, flossing before bed is more important than most people realize because it removes the bacteria that hide between teeth where dry conditions allow them to cause the most inflammatory damage overnight. The inflammation connection is what transforms dry mouth from a minor annoyance into a genuine health threat that accumulates silently over months and years. But inflammation is only part of the story, because the next warning is something that affects your body and your brain in ways that might surprise you. Number 2. Your blood sugar is swinging out of control at night. This is the warning that catches almost everyone off guard. Most people do not know that dry mouth and blood sugar are deeply connected, and the relationship goes both ways. High blood sugar causes dry mouth, and the dry mouth environment makes blood sugar problems even worse. It is a vicious cycle that millions of people are trapped in without realizing it. When your blood sugar rises, your kidneys try to flush out the excess glucose through urine. This pulls water from your tissues and dehydrates you, which directly reduces saliva production. A study in the Journal of Oral Pathology and Medicine found that 76% of people with undiagnosed type 2 diabetes reported dry mouth as one of their earliest symptoms, often appearing years before they received a formal diagnosis. That is a staggering number, and it means that your dry mouth could be the very first clue that your blood sugar regulation is failing. But it does not stop there. The dry environment in your mouth changes how your body handles glucose overnight. Researchers at Columbia University found that the inflammatory bacteria that thrive in dry mouths release endotoxins into the bloodstream, and these endotoxins interfere with insulin receptors on your cells. Their 2021 study showed that participants with chronic dry mouth had fasting glucose levels that were on average 12 milligrams per deciliter higher than those without dry mouth, even after controlling for diet and exercise. Over time, that kind of elevation pushes you directly into pre-diabetic territory. A long-term study from the Karolinska Institute in Sweden followed over 8,000 participants for 15 years and found that those with persistent oral dryness had a 29% higher risk of developing type 2 diabetes. The researchers concluded that dry mouth should be considered an independent risk factor for metabolic disease. Managing this connection requires attention to both your blood sugar and your oral health simultaneously. First, avoid eating within 3 hours of bedtime because late-night eating causes blood sugar spikes during sleep, which triggers the dehydration cycle. A study in the journal Obesity found that participants who stopped eating by 7 p.m. had 18% lower overnight glucose levels compared to those who ate until 10 p.m. Second, if you have not had your fasting glucose and HbA1c levels tested recently, schedule that appointment now. HbA1c shows your average blood sugar over the past 3 months and is the most reliable indicator of metabolic health. Third, add a short 10 to 15-minute walk after your last meal of the day. Research published in Diabetologia showed that post-meal walking reduced blood sugar spikes by 22% compared to sitting. Fourth, cinnamon has shown promise in improving insulin sensitivity. A clinical trial at the Beltsville Human Nutrition Research Center found that just half a teaspoon daily reduced fasting blood sugar by 18 to 29% over 40 days. The message here is clear. If you are waking up with a dry mouth consistently, getting your blood sugar checked is not optional. It is urgent. Now we arrive at the number 1 warning. And this is the one that researchers say is silently affecting millions of people every single night. Number 1. You may have sleep apnea and not know it. This is the warning that ties everything together, and it is the one that doctors and researchers are most alarmed about. Sleep apnea is a condition where your airway partially or completely collapses during sleep, cutting off your oxygen supply for seconds or even minutes at a time. When this happens, your body panics and opens your mouth to gasp for air. This mouth breathing dries out every surface inside your oral cavity and is the single most common cause of chronic morning dry mouth. The numbers are genuinely frightening. A 2023 study published in The Lancet Respiratory Medicine estimated that approximately 936 million adults worldwide suffer from obstructive sleep apnea, making it one of the most prevalent conditions on the planet. But here is what makes it truly dangerous. The same study found that roughly 80% of those cases are undiagnosed. That means 4 out of every 5 people with sleep apnea have no idea they have it. They just wake up with a dry mouth, feel tired, and push through their day. A landmark Stanford University study published in 2023 is the one that called this a silent epidemic. The researchers tracked 1,500 participants over 5 years using advanced sleep monitoring equipment and found that untreated sleep apnea caused measurable damage to the heart, brain, kidneys, and liver. Participants with moderate to severe untreated sleep apnea had a 140% higher risk of cardiovascular events, including heart attacks and strokes. Their brains showed accelerated shrinkage in areas responsible for memory and decision-making, with volume reductions equivalent to 5 to 10 years of additional aging. Oxygen levels in untreated patients dropped to dangerous levels, an average of 30 times per hour during sleep. Every single time your oxygen drops, your blood pressure surges, your heart races, and stress hormones flood your system. This happens dozens of times per night, night after night, for years. A 2022 study in the European Heart Journal found that people with untreated moderate sleep apnea had a 68% higher risk of developing atrial fibrillation, which is an irregular heart rhythm that significantly increases stroke risk. The brain effects are equally devastating. Researchers at the University of Sydney found that people with untreated sleep apnea had significantly lower scores on memory and attention tests, performing 15 to 20% worse than matched controls. Getting diagnosed is the critical first step, and it has become much easier than most people think. You no longer need to spend a night in a hospital sleep lab. Home sleep tests are now widely available and have been validated by multiple studies as highly accurate for detecting obstructive sleep apnea. A 2021 comparison study in the journal Sleep found that home testing devices correctly identified apnea 94% of the time compared to lab testing. Ask your doctor for a referral or order an approved home test. If you are diagnosed with mild apnea, sleeping on your side instead of your back can reduce episodes by up to 50% according to research from the Netherlands. Losing even 10% of your body weight has been shown to reduce apnea severity by 26% in a study published in the American Journal of Respiratory and Critical Care Medicine. For moderate to severe cases, a CPAP machine is the gold standard treatment. Modern CPAP devices are quieter and more comfortable than ever before. A clinical trial at Johns Hopkins found that consistent CPAP use reduced cardiovascular risk by 42% and improved cognitive function scores by 17% within just 3 months. The connection between dry mouth and sleep apnea is so strong that researchers now recommend that anyone with persistent morning dry mouth should be screened for sleep apnea regardless of whether they snore or feel tired. Your dry mouth might be the most important health clue your body has ever given you. So there you have it. Those 6 warnings are what your body is trying to tell you every single morning when you wake up with a dry mouth. From medication silently drying you out, to dehydration aging you faster, to your oral microbiome being destroyed, to dangerous inflammation building up, to blood sugar spiraling out of control, all the way to sleep apnea silently damaging your organs while you sleep. None of these are things you should ignore. The good news is that now you know what to look for. You know the signs, you know the science, and you know what steps to take. If you found this video valuable and you want to keep learning how to protect your health with information that most people never hear about, hit that subscribe button right now and turn on notifications so you never miss a video. Thank you so much for watching.